The controversial National Health Insurance Bill has been signed into law by President Cyril Ramaphosa. It aims to provide access to quality healthcare for all South Africans. However, the bill has faced fierce criticism and many questions around its implementation and financing. And we have a panel to help us get a better understanding of the NHI. What is it? What does it intend to do? What should implementation look like? For more on this, we speak to public health medicine specialist, Dr. Lehlohonolo Majake, KeReady Youth Doctor, Dr. Inga Mgaleli, and Patrick Jolomba, who is a medical science researcher in the UK. So we are joined on the line by Dr. Majake, who we will be coming to shortly. But Dr. Inga Mgaleli, thank you so much for making the time to be here in studio with us today. First and foremost, let's talk about KeReady as an organization that you established. You pioneered this organization, which is a youth-centered organization that provides services through mobile facilities, right?
Yes.
What is your position when it comes to the National Health Insurance Bill?
Okay, so particularly when it comes to the National Health Insurance Bill, we already know or can acknowledge that the two-tiered system that we have in South Africa, is not working. We are spending a lot of money and we are investing a lot of revenue in healthcare services, but we're not seeing results, we're not seeing outcomes. And so the National Health Insurance Bill speaks directly to this. So from our perspective, really, we do welcome, anything that will improve the status quo. There's a lot of challenges that young people are facing in this country. Things like geographical barriers to health and infrastructure, which has been discussed at length, are things that are universal to the South African experience of using public health services. But things such as stigma as well as discrimination are things that particularly affect the youth when they access healthcare services, particularly because of a culture misfit as well as a lack of youth-friendly services. So really, our concern and really what we want to see is how the NHI is going to address those challenges and, how they're going to innovate health that speaks to the young people directly and the challenges they face in South Africa.
Now, Dr. Lehlohonolo Majake, welcome to Newzroom Afrika, and thank you so much for being part of the conversation. Now, as a public health medicine specialist, you're also the CEO of the Steve Biko Academic Hospital, which is a public hospital. So you are the perfect person to really weigh in on the NHI bill, but more specifically, let's start right at the very beginning. What is it in layman's terms, and what does it mean for me? What does it mean for my grandmother in Kwili or Kunu or in Lusigisigi?
Okay, thank you very much, Master Chava. Just to say that I come just as a public health medicine specialist in this capacity today. The NHI is essentially, it's a trailblazing movement that's now taking place. What it means is exactly what has just been addressed now. We need to start having a healthcare system that is fit for purpose. Currently, our state of affairs is such that when we think of health, we think of a hospital-level care. What we want to move to now is to have healthcare that will actually be in the population's hands through primary healthcare. And even now, with the NHI bill that's now been changed into an act officially, there's going to be a lot of focus on primary healthcare level. What I want to say is there's nothing really that is new that is changing now. Over the past 15 to 20 years, there's been work in progress behind the scenes towards getting us ready for NHI. We've looked at things such as, community-orientated primary health care, ward-based outreach teams, school health systems that have developed where children now get access to various facilities from a health perspective directly at the schools. I think many people have heard of community health care workers that actually go out and assist with, certain ailments. So what this means now is we consolidated the whole system to actually get healthcare right down to the people. It's still a work in progress. It's going to take many years to actually get there. But I mean, even with the healthcare system currently, we've just mentioned the two-tiered. We now have one National Department of Health. There was a time where we had about 15 different National Department of Health pre-1994.
How did that work?
It didn't work, and that's exactly why we had to then amalgamate it into one Department of Health. Remember, historically, it was really about making sure that as long as the few 6% of the country were catered for. The 94% of others would get mediocre substandard care. And in the previous government, that was seen as good enough. This current government has actually redressed it. And now the NHI is actually also adding on to the redress of the inequities.
Let's expand a little bit more on the redressing. And I want to know just from the both of you, we've recently seen, you know, it coincided with Mother's Day, but it was International Nurses Day on Mother's Day. I believe it was the 12th of May, if I'm not mistaken. It was a Sunday. We spoke to Hayitu, and the president of Hayitu basically said that we are boycotting this day because there's nothing to celebrate here. You know, our public health facilities are not working for our nurses. They're not working for anyone. He made mention of a lot of things. I mean, mismanagement of funds, administration issues, as well as the treatment of healthcare practitioners. Now, how is this NHI intended to, how should it be implemented in a way that it will better the services? Because there are already complaints from healthcare service providers saying that already the public system is not working.
Right. So, Yumi, I'm not, you know, an expert to speak on policy as well as governance, but what I will say is that definitely to see the implementation of the NHI, first of all, we need sustained political will, we need adequate funding, and we need good governance. And so, really, the challenges that healthcare workers are experiencing, you know, I'm not foreign to them myself. I've been there, I've experienced it myself. And also there is this concern about what it will look like to be a healthcare worker on the ground with NHI coming into the picture. So look, you know, that's what I would say, really. Those three things would be key in seeing the successful implementation of NHI.
Fantastic. And I'd like to weigh in, and especially as a public health specialist in this particular field, I think you can weigh in a bit more on this matter.
So, Masishaba, you know, the NHI Act is actually bolstering what currently is existing in the country and redressing the wrong. When you look at various policies such as human resource for health, we've realized we actually can't churn out the higher level of medical healthcare workers that we're getting. And that's why we then had the mid-level workers, which is your, you know, your clinical associates, you know, more pharmacy assistants and so forth. But the core of it all is there's a bottoms-up approach that's been taking place in South Africa. Remember, historically, you know, when you look at healthcare, it's always been hospice-centric.
Hospice-centric.
Which means predominantly hospital-centered.
Okay.
And there was a huge focus on having hospitals opened, etc. But it then subconsciously led to a behavior, healthcare behavior of communities, where you only go to a hospital when you are sick. And that's not how health actually works. Health is about you screening yourself and making sure that you are not sick. And by doing that, you then catch the disease much earlier than when it progresses.
So I think you need to tell that to the men.
Men, and
I've never seen a gender that is more afraid to see a doctor than a man.
Absolutely, no, you're spot on with that.
Yeah.
So this is the whole thing about the national health insurance that is actually looking at addressing currently. What we don't understand is once you have a community that understands its health and really takes care of itself, you don't really need hospitals per se. Hospitals are supposed to be at the tail end of care, but currently it's seen the other way around. And you don't really need to have massive infrastructure if you've got more and more people who actually know what their glucose status is, what their blood pressure status is, what their pap smear results are, what their PSA results are. Once you catch that, and that all of that is done at primary healthcare level, at clinic level, and it doesn't have to be a doctor as well, because we've got this misnomer that you can only be treated by a doctor. You also have very skilled primary healthcare nurses. We've seen that change with HIV when we started having more NIMAT training nurses and so forth. So it will, over time, then address all these problems with the infrastructure challenges that cause the long queues.
All right, I see the infrastructure challenges, and thank you so much for giving us that context. But just to stay with you now for a second, you spoke about, you know, not churning out the level of healthcare workers that we should. Why is there a shortage of healthcare workers? especially in a country where there are such high unemployment levels? Where do you think we're getting it wrong?
Yeah, so there certainly is a finite number of doctors that can be produced per year. And that's exactly why then the previous Minister of Health then went for the Fidel Castro Nelson Mandela agreement, where we then had doctors being trained in Cuba and so forth. So that's the first thing. Secondly, it's the nature of how we look for health. The fact that we believe that when you are sick, you need to go to the doctor, and we need to change that around. Prevention has always been better than cure. And it goes back to even 1940s. Funny enough, based on a principle that was actually founded in South Africa, there's a couple of clocks who actually discovered, lower level individuals, which were predominantly African community, who were workers, and they come up with a document that actually informed the Alma Ata Declaration. So that's where we're going wrong.
Okay.
And the issue now is, should we have systems to create more doctors? Absolutely not. We need to have systems that will catch diseases earlier and give capacity to individuals to make sure that they actually look after themselves and their children and so forth.
Yeah. Now, Dr. Inga Mgaleli, you've been nodding right along as Dr. Lehlohonolo was speaking. What would you like to add to that?
No, I just really want to echo, what Dr. Lehlohonolo has said about the importance of preventative care. And really the NHI bill does speak quite a bit to, re-engineering primary health care in this country. And particularly when it comes to comprehensive health education, because really you can't have a South Africa that understands health if they don't know about health. So we really also need a robust, comprehensive health system. And even now, we're having a discussion about what the NHI is, but if you go to the deep rural areas in South Africa, if you go to the townships now, can you have a conversation with a South African about what NHI is, what it aims to address, what challenges it aims to resolve?
And that's exactly why we're having this conversation right now, because the bulk of South Africans, especially on the ground, there's still too many question marks, but we'll hopefully try and fill that gap a little bit. But we are staying with this conversation for that purpose. We continue with public health medicine specialist, Dr. Lehlohonolo Majake, and KeReady Youth Doctor, Dr. Inga Mgaleli. And we'll hopefully bring medical scientist Patrick Jolomba, who's in the UK, to give us some context around how this has been implemented in other parts of the world. Stay with us. Welcome back to the Weekend Report. I'm Masachaba Kumalo. We continue with the conversation with public health medicine specialist, Dr. Lehlohonolo Majake, and KeReady Youth Doctor, Dr. Inga Mgaleli. We're having our roundtable discussion on the NHI, just really to unpack it a little bit more intricately in layman's terms to understand what it is and ideally how it should be implemented. So ladies, thank you so much for joining us. Hopefully we'll be joined by Patrick Jolomba, who's also a researcher who's based in the UK, to kind of like weigh in on the differences between their version of the NHI, which is the NHS, and kind of ideally look at how the NHI in South Africa should be implemented. But we were engaging just before we took a break on the kind of getting into the challenges, but also looking at how the NHI will solve some of the challenges within the medical fraternity. But I want to ask you in all earnesty, Dr. Lehlohonolo Majake, are we ready for the NHI?
The answer is absolutely yes, purely because we have been working behind the scenes with the National Health Insurance. You will recall that around about 2013, there was a National Health Amendment Act, which was focusing on incorporating the quality body, which is now the Office of Health and Compliance. What that was doing is going around the country. They've been traipsing around the country, really looking at where we are in terms of, norms and standards. And around that time as well, then the previous minister developed also the 6 ministerial priorities, which looked at things like safety, cleanliness, etc. And that was then evolved into the ideal hospital framework. So we have been doing a lot of work behind the scenes. Private sector has also been engaged behind the scenes. Currently now, even private sector has to report certain indicators to make sure that they actually are compliant with, the Office of Health and Compliance. So this is not just something that is just happening now as a knee-jerk reaction, contrary to, the rhetoric that's out there. Popular belief, that it's all part of an election ploy. It never has been part of an election ploy. It's actually something that's been work in progress. I think certainly, are we ready to the T to have it in a perfect system? Absolutely not. But everything is work in progress. And, even now with the Act really being formalized, it has been mentioned that it's going to be done in various phases. But the first phase, of course, is going to be centered around primary health care before then it goes off into the hospital level.
All right, so we are now joined by Patrick Jolomba, who is a medical sciences researcher in the UK. Patrick, good morning, or rather, good evening. What time is it in the UK there? I can't keep up. We've been connecting to so many people all over the world.
Okay, we are only just an hour behind you, so that would be 7:30. Good morning.
Good morning to you. Thank you very much. All right, so let's talk about now. There's a stark difference between the NHI and your version of the NHI there in the UK, which is the NHS. Now, just give us some context in terms of the implementation of the NHS in the UK, just so we can understand how it's supposed to work.
Yeah, the NHS, which is the National Health Service, which was set up, way back 76 years ago, in fact, 1948. It is similar. I think it was set up on the basis of providing, equitable access to care, which is the similarity. I think if you look at, the proposal in terms of the NHI, it is also looking at, accessibility of, affordability into healthcare for the wider public. I think it's the idea of it is free healthcare at the point of contact for anyone. That's the striking similarity. But the NHS, if you look at the NHS and other healthcare models, perhaps, the Taiwan, the Brazilian, so the NHS particularly is looking at, the government funding, right? And I can see with NHI there, it's more kind of single payer a funder, which perhaps is the difference here. It's the tiny difference in terms of who's funding. But I think the fundamental similarity is the fact that they're both looking at providing free healthcare, if we put it that way, for every resident. And this is exactly what the NHS offer. And there is advantages and disadvantages of different models. For example, you have seen, since, as I said, 1976, when 76 years ago, when the NHS service was set up, there has been vast amount of improvement in terms of healthcare research. We've seen the first CT being done in the UK. We've seen MRI in the 80s. We also seen, which is interesting, what they call walk-in centers, okay? This will be like facilities where there will be a doctor and a nurse. It could be in a town center. You can simply just walk in and see someone. You don't have to pay a penny for that. I think that's an advantage when you look at, equitable healthcare access.
All right.
But I think that the difference do there exist.
Now, let's break it down just a little bit more. What are the critical stages for the successful implementation of South Africa's NHI system?
And then the first that you want to look at, you're going to look at the infrastructure. It's a very costly exercise. If you're going to provide, healthcare for everyone, you need to have the right, resources. And this is human sort of resources. You need to have the, right number of doctors and nurses and other healthcare alliances that are involved. You need to have the whole sort of infrastructure that will provide that. That is the key. But also, you have to have a governance. If you look at the NHS, for example, it's managed purely by the government and the Ministry of Health. It runs throughout the country in that sense. So, potential problems perhaps that tend to exist, not just in South Africa, but in Africa, such as corruptions, they can hinder that process as well to a greater degree. So there is a lot of planning that has to be there in place. But I think the infrastructure is the fundamental base of creating a system, a healthcare system like that is universal for all, that is free at the point of contact. You need to have the right facilities. And I think that's the main thing really here. And it does take time. If I take you back again to the National Health Service, it was set up in 1948, but Sir William Beveridge started talking about it in a report that was created in 1942. So 6 years down the line, that's when it was actually set up. But the question that perhaps you could ask is it all faultless? Is it running smoothly? No, there isn't any system in the world perhaps that is faultless. If I take you to the stage, the Obamacare, what they call the Affordable Care Act as well, it was criticized politically, it was taken to court to a certain extent, and that is similar to the NHS. It was criticized. The doctors at the time did not agree with the principle, the process of trying to provide this. They said it was going to be costly and difficult to manage. The British Medical Association at the time, they actually also protested hugely. So I'm not surprised to see, debates, in South Africa. I'm not surprised to see, different factions taking different views in this. So it is pretty similar throughout the world.
I mean, ideally, doctors, I'm sure you can both agree with me. Thanks very much for that context, Patrick, that this is a good thing. I mean, universal access to quality healthcare is something that we should all be rooting for. But then what do you have to say, Dr. Lehlohonolo, about the argument that, well, disadvantaged people already have access to the public healthcare system, so why do we need the NHI?
So the question is, what is access? Access is definitely not getting into a clinic, all right? We call it social determinants of health. There are various factors that will dictate whether or not you can have access. Even now, if you had to build a state-of-the-art facility in a rural area, if you don't have the correct roads to actually get there, so forth, there still is a major problem with access. And secondly, I think it really is unfortunate to have individuals saying such things, because we all know that health is also quite concurrent, and this is what we're trying to redress now with NHI, with your financial ability to gain access to certain things. When you are more disadvantaged, you're more likely to have poorer health outcomes, because it means you live in an area that also has various challenges that then impact negatively on your health. Also, you do the type of work that doesn't really allow you to take a day off. If you're selling tomatoes every single day, you're selling potatoes, a day spent away from there means you might not be able to eat that night. So it's quite a selfish statement to actually have. And I think if you look at the concept of the universal healthcare coverage, which is NHI in South Africa, it is a global cause. It's a global cause of making sure that we really don't leave those most in need, who are those who are most disadvantaged, behind. It's informed by the United Nations. When you look at the convention that actually addresses, the human rights and the social component of it. So this is not really, political scoring. This is about really bringing dignity to the average person who really was just born on the wrong side of the line.
Mm-hmm. Now, Dr. Mgaleli, how should the NHI translate into holistic healthcare for young people in particular?
So as I've mentioned before, really it's about addressing the challenges that speak directly to young people. It's about ensuring that there's youth-friendly health services. It's about ensuring that young people who now particularly have limited access to mental health care services, we tailor that into the primary healthcare services. It's also about addressing comprehensive health education, so that young people, not only young children, older people, can understand, the social determinants of health, and their rights, and how, to improve their own health outcomes. So I would say really it's about speaking to the challenges that South Africans have, and it's also about having engagement, and it's important to have these sort of platforms as well that you have highlighted, so we can have robust conversation and engagement and understand exactly what those challenges are.
So in closing, Dr. Lehlohonolo, what do you say to people who say, like, the NHI is a Rolls-Royce solution when we can't even afford a Toyota?
I'd say you need to really have platforms such as this, listen to them. I would encourage individuals to also read. All you need to do is just look at, there's a beautiful review, Lancet review, on the health system of South Africa. If you read that page by page and engage with various individuals such as Dr. myself and other individuals that you have, get to understand the crux of the matter and the history behind it. And why it is that the current story we've been sold, that hospitals is the key to it all, medicals are the key to it all, is completely inept. It's definitely not sustainable. And get informed. I think that's the main thing. Another thing is you shouldn't panic. I think there's a lot of panic out there. The panic is also the fact that our government is too open.
But also, who's panicking? Let's be real.
But also, who's panicking?
Because I can tell you now, a young lady who has to walk I don't know how many kilometers to get to a clinic for any type of visit is not panicking.
Absolutely.
Yeah. So maybe we need to get off of our high horses.
Absolutely, and that's the whole thing. And whether we like it or not, everybody who actually resides in the country counts. And it's time we actually acknowledge that, and we become active agents in making sure that we don't leave others behind. This is actually the crux of national health insurance and having access. And, you know, especially because South Africa is such a young country. You know, when you look at our demographics, predominantly the biggest population is actually the youth. You know, the youth who are now suffering so many ills. If it's not unemployment, you know, it's the drug situation, you know, and then of course there's also the fact that even getting access to health, which is life, is a challenge. So there's a lot of redress that needs to take place, and this is the vehicle that is actually going to assist us with addressing that.
Well, the step has been taken, and the president has spoken or has signed the bill. It is what it is. We are here now. And ideally, this is something that we should all root for, but obviously, we have to have many, many conversations about this so that we all reach our comfort levels in understanding exactly what it is and ensuring that it is implemented the way that it's supposed to be. That was public health medicine specialist, Dr. Lehlohonolo Majake. And I'm also with Dr. Inga Mgaleli, who is from KeReady Youth Doctor, as well as Patrick Jolomba, medical sciences researcher, joining me from the UK. Weigh in on the issue by tweeting us on X at Newzroom 405.